We're going to take care of it. Come on.
Video from a San Diego police body camera in 2018 captured Isabel Rosales running from her home. She'd been stabbed and had her throat slashed.
And I just started screaming for help. I started screaming that my kids were in my house. I started screaming his name.
The name she screamed is David Espinoza, her husband at the time. This scene played out on a street in Old Town San Diego. Espinoza attacked her as she tried to escape through a screen door while her 3 children watched.
I remember seeing my girls jump up from their bed, and my son was laying down right in front of me, and the blood splashed on his bed, and he pulled me, but he had this look, like an evil look.
Experts say the most dangerous time for domestic violence victims is when they try to end the relationship with the abuser. Isabel ended up in a UCSD emergency room. The physician, suspecting domestic violence after treating her, contacted police as mandated by law.
All I wanted to know was that my kids were unharmed, that they were okay, they made it out the house, and he was going to go away.
He did go away, pleading guilty and sentenced to 23 years in prison for attempted murder and spousal rape. In Isabel's case, mandated reporting for suspected abuse worked exactly as the law intended. But Tina McKinner, a Democratic Assemblywoman from Los Angeles County, has proposed a bill to change the law. The bill is supported by more than 60 activist groups.
This makes them safer.
McKinner and other supporters of the bill, AB 1028, say mandated reporting infringes on the autonomy of potential domestic violence victims and increases the dangers they face. Her proposed legislation would leave it up to victims to decide whether police are called.
If the victim wants to press charges or call the police, they're still able to do that. They can ask the doctor at that time to please call the police. This just puts the control in the victim's hands.
McKinner argues diminishing the role of police in these cases will encourage more domestic violence victims to seek help. A hospital would be expected to provide phone numbers to victims for services, nothing more. No police, no healthcare professionals would be required to get involved. This is a mistake, says Hillary Larkin, a physician's assistant and legislative director for the California Sexual Assault Examiners Association.
We are boots on the ground, so we are seeing patients in healthcare settings and documenting injuries.
Larkin works in one of 48 healthcare teams across California who do as many as 14,000 exams on trauma patients each year. She says the bill would reverse years of progress.
We don't consider it mandated reporting. We consider it documentation of injuries sustained by a victim of a crime.
San Diego County District Attorney Summer Stephan and San Diego City Attorney Mara Elliott also oppose the bill as written. So does former San Diego City Attorney Casey Gwinn, who prosecuted over 10,000 domestic violence cases before he left office in 2004.
And anybody thinks this bill is pro-survivor or pro-domestic violence intervention is deluding themselves.
McKinner and her supporters argue that the current reporting requirements put women of color at greater risk. They say treating domestic abuse requires a health-based approach, not a law enforcement one.
So you walk in, you seem to be, you're beat up, and the doctor just calls the police with no services. This is very, very dangerous for women of color and any type of minority, immigrants as well, LGBTQ folks.
In 2002, Gwinn started the Family Justice Center to protect victims in San Diego. It links abuse victims with legal, medical, and social services. There are now over 140 similar centers across the globe. Gwinn says McKinner's bill would have unintended consequences.
There will be absolutely no reporting in those cases where the victim is too terrified to report to police.
The new bill would continue to require reporting to law enforcement, quote, where the injury is by means of a firearm. Larkin says that's not enough. All violence should be reported.
Not just gunshot wounds, stab wounds, strangulation, run over by a car, beaten with a hammer, all these things I've seen in my practice within the last 6 months.
AB 1028 has cleared the state assembly and goes before the California Senate's Public Safety Committee on Tuesday. Amita Sharma, KPBS News.